So, Jim, you're here today, not even 2 weeks after your Achilles tendon surgery, right?
Yes.
And, I'm kind of excited because I'm letting you walk without any special boot or anything like this. And you're actually leaving town for 2 weeks. And since it's a new surgery, I'm going to kind of introduce whoever is watching this video about the new surgery that we had. So, you came to me and you were on blood thinners, and you still are. So we kind of decided not to do the old-fashioned invasive surgery where I go in and take the Achilles tendon off the bone spur, and then I take the bone spur off with a chainsaw, right? Not a chainsaw, but
gruesome.
it's basically a saw that we use, and then we reattach the Achilles tendon back with two bone anchors. And I know the moment I talked to you about it, you're like, I need an alternative procedure.
Yeah.
And luckily, we had a relatively new procedure. It's been actually out for about 2-3 years. It's called Tenex, Tenex procedure, where we take two small stab incisions and we basically go in with a ultrasonic knife, sort of speak, and we repair the tendon and take the spur out. And unfortunately, we cannot take the whole spur out, but we take most of it out. And of course, the goal is for you not to have that pain you had before the surgery. So, you're not even 2 weeks out, and there is a reason why we're doing this testimony, because I want you to tell me how much better are you?
Oh, virtually 100%. Other than the fact that it's still a little bit stiff, but the pain is gone completely.
Right. So basically, as of right now, you're pretty happy the way the things had been going, right?
Oh, yeah. Very, very little discomfort from the day after the surgery on.
Did you have to take pain medications?
I did for like one day, and that was probably more just to sleep better that night.
Right.
Just one day, and that
But
was
it's
it.
not like you had excruciating pain.
And I don't think I really needed the pain. I could have taken Tylenol, that would have been fine.
And you didn't have incisions, you had no stitches. You had to be off your foot for a week, right?
That was not fun.
Right, that was not, well, can you imagine 1 week versus 4 weeks, right?
Absolutely, yes.
So, everything is in comparison, exactly, right? And you were able to resume your blood thinners right away, and you didn't have an incision, so everything was very easy, relatively speaking.
Much easier than I expected.
Right. So, for a person who is sort of facing the dilemma of having this open surgery with 4 to 6 weeks of immobilization and non-weight bearing versus the new procedure, would you recommend the new one?
Oh, absolutely. Absolutely. I'm amazed that this got solved so easily.
Right. Well, I can tell you is I'm cautiously optimistic. We still want to be sure you're taking it easy and stretch it, and I want to be sure you wear your orthotics and your tennis shoes and no barefoot walking for right now.
Right.
And well, thank you for your testimony.
Sure.
All right.